Okay, we're going to go through this because you asked a really good question, or you asked a question that led to, I think, an interesting discussion. But you kind of talked about SMAS in the context of a deep plane facelift. So you underwent a deep plane facelift. And then I think people out there who do their research know that there's something called a high SMAS facelift. And I kind of have this thesis that actually the two procedures in many ways are kind of converging in terms of what people do when people call a deep plane facelift. But it points to the fact that there's not a common language that people use that's consistent when they're describing facelift anatomy and what's actually done technique-wise. But the original description of a deep plane facelift is what many people call a deep plane facelift now, but it's where you enter the sub-SMAS location here, and then dissect the tissue. One of the benefits of that is that you elevate the skin, which is the easier dissection, and then you enter the SMAS where it's a little bit easier to enter it and dissect it. And there's actually less dissection underneath the SMAS than is necessary otherwise. And you can elevate the tissues in a more direct way because you're closer to the tissue that really needs to be repositioned at a deeper level. A high SMAS facelift means entering the SMAS somewhere in this zone here, just at or above the zygomatic arch or the cheekbone that we feel out here. So normally a deep plane facelift, again, entered somewhere along that line, and then high SMAS entered along here. And ultimately with a high SMAS facelift, you do end up dissecting down to this area, and then in a variable way dissect beneath the SMAS in a way that's continued all the way perhaps to the nasolabial fold. But what makes a high SMAS facelift a little bit more difficult is that you end up having to lift up a lot of the SMAS in an area where it's not, it's called the fixed SMAS, in an area where it's not necessarily necessary to elevate to reposition the tissue. A lot of people say that in a deep plane facelift, even when they're calling it a preservation deep plane facelift, that you're lifting up less skin. But that actually is based on a little bit of a false premise, and that false premise is that that a high SMAS facelift for some reason lifts up a lot of skin. But in the past, when I had done high SMAS facelifts, I actually limited the skin elevation to about here, which is pretty similar to what I and many people do for a deep plane facelift. So the real difference, once again, is that with a high SMAS facelift, you're entering here to here. And this is another difference, is that with the SMAS, the high SMAS facelift, you're securing the SMAS or the deep plane, because again, it is deep plane. You're securing that with tissue that's been elevated under the skin along this line here. So it's a little bit removed, a little bit remote from the tissue that really needs to be repositioned to get that youthful change. So again, the sutures that secure the deep plane originate here and are elevated sometimes with a span up to the deeper, thicker tissues here. Whereas a high SMAS facelift, same dissection from here on out, but because you're lifting here, the sutures tend to be a little bit closer to the location where they're secured. So that, again, they're a little bit remote from the area that needs to be elevated and repositioned the most. So I'm sure that's crystal clear. I'm being sarcastic, but it does shed some light.
Absolutely.
And also while we're talking about this, let's talk one more time about some of the other alternatives. One is it still involves the SMAS, but it's called a SMAS plication. And those lifts, skin might be lifted to about here, and then the SMAS at the junction of the fixed SMAS, where it doesn't move a lot and where it does move a lot, is kind of folded over, bunched up in some cases, and sutured together. That does lift the cheek. I think it doesn't do it as much, and also you can't do it in a vector that's as vertical as I think is important. And then there's also called a SMASectomy, which is similar to a SMAS plication, where you lift up the skin. You're not really dissecting beneath it, but ectomy in surgical terms always means removing. So you take a strip of SMAS out in this area here and then suture it together. And there's variations of all of that. But again, sort of the Adam Weinfeld convergence theory of the terminology for facelifts that are sub-SMAS, which is true for a high SMAS facelift and a deep plane facelift, is that those terms are kind of converging, because now a lot of proponents of deep plane facelift are suggesting entering here, and then having some degree of SMAS that comes away from that straight line that they're elevating. So the closer that elevation, that line of elevation comes to out here, the closer that D-plane facelift that everybody is saying is not a high SMAS facelift is becoming a high SMAS facelift. None of it's necessarily relevant to what's important is that, if you're going to seek a facelift, do it with someone who is able to customize what makes sense for the patient, has experience with it to keep it safe, and someone you can work with, because there may be some bumps along the road, and you want to make sure you're working with someone you can trust and someone who's available. So anyhow, thanks for allowing us to use you as an example, given it was you had a great question that led to that discussion.